Welcome to The Explainer. Today, we're diving into something truly huge, a brand new public health facility in Kerala, India that's been, get this, a decade in the making. We're talking about a project that's poised to completely change the game for cancer treatment for thousands of people. And it all boils down to one absolutely staggering number.
All right, let's just get right to it. The number that really kicks this whole story off? 450 crore rupees. Now, to put that in perspective for some of you, that's around 54 million US dollars. Yeah, that is a massive figure, and it speaks volumes about the level of commitment we're seeing here to public health care.
And look, that kind of money isn't just for, bricks and mortar. This is a full-blown investment in a world-class cancer research and treatment center. It's been designed from the ground up with a really clear mission: to serve the people of Central Kerala and take some of the pressure off other big hospitals in the region.
So, what's the big deal? What is this project that got such a huge price tag? And why is everyone talking about it right now? Well, let's get into the grand opening.
So, on February 9th, 2024, the Chief Minister himself, Pinarayi Vijayan, cut the ribbon. And this was a huge moment. I mean, it wasn't just a win for the hospital, but for the entire state's healthcare system. This was it, the moment all those years of hard work finally paid off.
And when we talk about scale, wow, this thing is immense. We're talking about an 11-story building. It covers 5.5 lakh square feet. That's over 500,000 square feet. So let's be clear, this isn't some little add-on or a small expansion. No way. This is a total transformation, creating a brand new modern hub for cancer care.
Okay, so a huge building is one thing. But let's go inside. Let's see how all this space and the amazing tech packed into it is actually going to help patients. Because at the end of the day, that's what really matters, right? That's where this investment shows its true value. And wow, this place is just packed to the gills with state-of-the-art gear. You've got not one, but multiple super specialized ICUs, one for surgical patients, another for medical, and even one for transplants. Then there are 6 modern operation theaters. I mean, the whole setup is designed to handle the toughest, most complex cases. Everything you need, all in one place.
And this right here, this shows you the real impact. Look at that jump in capacity. They went from 110 inpatient beds to 252. That's more than double. What does that mean in real terms? It means way more people can get that intensive 24/7 care when they need it most. It means cutting down those long, stressful wait times and just making care easier to get.
Something this big doesn't just pop up overnight. Not even close. A project like this is the finish line of a marathon. We're talking years of planning, hard work, and a whole lot of dedication.
And this timeline, man, it really shows you what a long road it's been. The foundation stone was laid way back in 2014 by one chief minister, Oman Chandy. Then, after all those years of construction, it's inaugurated in 2024 by another, Pinarayi Vijayan. It's pretty cool to see a project this important for the public good get carried forward across different political administrations to finally get done.
Okay, so we've talked about the impressive numbers, the cool tech, the long journey. But let's get to the heart of it. What's the why? What's the real human impact of a place like this?
Well, I think Kerala's health minister, Veena George, really hit the nail on the head. She called it a great leap for the state's health sector. And that's exactly what it is. It's not just another hospital building. This is about raising the bar for public health care, setting a new standard for what people can and should expect.
So, what's the game plan for the future? Well, it really boils down to 3 big things. First, and this is huge, making top-tier, affordable cancer treatment available to thousands of patients. Second, using all this amazing new technology to get better outcomes, better survival rates, better quality of life. And third, the big picture goal, to make the Cochin Cancer Research Centre a name that's known across the country as a leader in both care and research. And that really brings us to our final thought. Seeing a massive public health project like this actually come to life, it makes you wonder, doesn't it? What does the future of accessible, government-funded healthcare look like? When you see what's possible with this kind of investment, it really gets you thinking about the vital role these projects play, not just in India, but everywhere, in keeping us all healthy and safe.